Hello, everyone. My name is Mitisha Gupta, and I am your host for today's podcast, Win Over Hypertension, where you can learn how to take care of your blood pressure through exclusive insights and practical advice. Today, we're talking all things about hypertension, why is it caused, how it matters, and most importantly, how to take care of it effectively. Hello, doctor. It's my honor to have you on this podcast today.
Well, hello everyone, I'm Dr. Alok Shah.
So, doctor, by now we all know what hypertension is. But can you please elaborate on it? I mean, why is it so important for us to take care of ourselves even when we feel fine?
To be very frank and very honest, you all don't know what is hypertension. It is something called fire behind the wall. You can just see the smoke, but you don't know actually what is the extent of illness. Well, it is the pressure which is extended by your blood flow to the blood vessels. And majority of the time, the illness is symptom free, and you will come to know once you have a problem. So this is something which is really very alarming. You will come to know your blood pressure level once you check, but most of the time majority do not have any symptoms, so they don't check blood pressure. Most of the time when we see patients with ICU that they have kidney illness, heart illness, brain stroke or something like that, then later on we find out that they have hypertension. So actually this is a disease which is seen as a tip of iceberg, and actually the ice is very deep.
Okay, but why is it so often called the silent killer? What makes it so dangerous over time?
Well, as I already said, it is called the silent killer because majority of the time it does not produce any symptom. It is an illness which slowly, steadily damage your heart, damage your brain, it damages your kidney, it damages all of your vital organs like eyes. So this is the reason it is called a silent killer.
So, doctor, I would like to know what are the most common reasons people develop high blood pressure? Is it genetics, lifestyle, or something else?
Well, I would say both of them, genetic and lifestyle. There is something called modifiable risk, there is something called non-modifiable risk. So something which you cannot change is your genes. These are called non-modifiable. So if you have genetic history of hypertension, you are likely to get hypertension. But there is something called modifiable risk factor. So these are like alcohol, smoking, your lifestyle, your dietary pattern, your exercise, your sleep pattern. So these are called modifiable risk factor of hypertension. So this can be changed with lifestyle modification.
How is blood pressure exactly diagnosed? When looking at the blood pressure readings, can you elaborate on the exact numbers people should be looking at?
Well, it's honestly a very tough question. It varies from person to person, but by large, American Heart Association has given a guidelines that 120/80 blood pressure is a normal blood pressure. But if your blood pressure is rising more than 130/80 in subsequent recording constantly, it means you're suffering from hypertension.
So I would also like to know, if someone has just been diagnosed with high blood pressure, what are the changes you would want them to make in their daily routine?
Well, honestly, not all the patients require medications. The first thing first is, if you are having any substance abuse like alcohol or smoking, boss, quit it first. Second, diet. You have to change your diet according to the blood pressure. Third is salt restriction. Fourth is sleep. Fifth is exercise. So if you do all of them, and if you are having a very mild disease, there are high chances that we can track your blood pressure back to the normal level.
Can we say that hypertension can be treated without medication?
Yes, of course. Hypertension can be treated without medication. If you're categorizing as mild hypertensive, there are 4-5 things which I'll enumerate which you should do. 1, quit smoking and alcohol. Second, 150 minutes of exercise per week. Dietary changes, salt restriction, adequate sleep, less tension and anxiety. If you do all these things, boss, you can treat hypertension if you are categorizing as mild hypertensive without medication.
Okay, doctor, you just talked about medication right now. So I would like to know, what are the most common side effects that people should look out for while taking medications for hypertension?
Well, when there are effects, there are always side effects. I'll enumerate the group of medicine and I'll enumerate their possible side effects. Well, first thing is diuretics. If you are taking diuretics, you may have loss of body water. That leads to low potassium and low sodium level. There is something called ACE and ARB group of blood pressure medicine. This may produce long irritating cough. There is something called thiazide medication. This can produce hyperuricemia. It means your bodily uric acid level goes beyond level. So there is something called amlodipine kind of medicine. This can produce your leg swelling. So these are the medication with some side effects.
Okay, I have a question related to that only. Let's assume that somebody's blood pressure is coming under control. Can they come off medication or is it a lifetime commitment?
I feel if your blood pressure level is constantly maintained, we can try off medicine. And if it is maintaining without the medications, we can try off medicine. So it is not a thumb rule that once you are started with hypertension medicines, you have to be always on the medicine. There are high chances that if you are categorizing as mild hypertensive, we can stop medicines.
Okay, when you say reassess regularly, how often people should check their blood pressure and what's the best way to do it right?
Oh, very tricky question. I've seen some patients who measure every hourly, second hourly, and get anxious by the levels. None of the medications work immediately. It's a war and it's a battle which is won over days and months. So let me give a small guidelines. If you are a mild hypertensive or if you are a hypertensive which is initially detected, for first month or first couple of months, you'll have to check your blood pressure morning and evening. Later on, 2 to 3 times a week is more than enough pause.
I would also like to know what would happen if high blood pressure gets untreated for years, especially the body parts which gets affected the most.
Well, let's take it scientifically. If your pipe having rust from inside, how long you will get fresh waters? So if your blood pressure is constantly very high, it will damage the inner part of your blood vessels. And if these blood vessels are of vital organs like heart, brain, kidneys, eyes, then you will have slow, steady damage over these vital organs, and eventually one day you will end up in hospital.
So this marks the end of our podcast, Win Over Hypertension. I would like to say a huge thank you to the doctor for sharing such valuable insights to us. Remember, hypertension isn't just a number, it's a signal. And with right knowledge and action, it's absolutely preventable. If you found this episode helpful, do not forget to like, share and subscribe and share your valuable insights with us. Always remember, stay informed, stay proactive and most importantly, stay healthy. This is Shah signing off from this podcast, Win Over Hypertension.